Good morning, it's Mark Larson here to talk about COVID-19 in Kittitas County. I'm going to talk about a few things today. I'm going to talk about vaccination, I'm going to talk about school reopening, and I'm going to talk about our current phases and the cases that we have going on in Kittitas County. So to start with, we are really close. We are really close to getting things back to normal, but we are not there yet. So I'm asking you to hold on a little bit longer, to continue to wear masks, continue to socially distance, and continue to get your vaccination. We have all done a lot of really good work, and we are so close to being done with COVID-19, but things are starting to go back up again. Numbers are starting to go back up again. And so this is not the time, it is not the time to drop the ball on the 5-yard line. It is time to continue to do good work. And so I'm asking you to hang in there just a little bit longer. So in regards to vaccination, we now have 3 different vaccines available in Kittitas County: Pfizer, Moderna, and Johnson & Johnson. We continue to have vaccine clinics every week, both in Upper Kittitas County and in Lower Kittitas County. We will be having a Saturday clinic coming up soon in Lower Kittitas County. The ability for more people to be vaccinated is going to happen starting on the 31st of this month. So that is Wednesday, that we will be able to have people in phase B, 1B, tier 2, tier 3, tier 4. So please take a look at that. It allows a lot more people to be vaccinated. The other issue is President Biden wants vaccine available for everyone at the latest May 1st. So we know for sure that by May 1st, everyone who wants a vaccine will be able to get a vaccine. It's going to happen sooner than that in Washington State. We had a big discussion with the health officers and the directors last Friday, giving some guidance to the governor in regards to what we thought should be done with getting more vaccine available, getting more vaccine in arms. And so I would expect a decision will be made relatively soon in regards to that. So it's not going to be May 1st, but at the latest, it'll be May 1st that anyone 16 and older can get vaccinated. Not all the vaccines are good, have been approved for people 16 and older. One of them is approved for 18 and older, so age does make a difference. So please get vaccinated when it's your turn. It allows us to continue to move forward. It allows our numbers to go down and allows things to happen like school reopening, as well as getting businesses reopened, getting the rodeo back going, those type of things. So vaccines are safe. Vaccines are effective. They're effective at not only preventing serious disease and death, but the data that was reviewed and came out this week by the Center for Disease Control shows that the vaccines prevent disease transmission and us getting even mild disease. So please get vaccinated when it's your turn. School reopening. All of the schools are moving forward to getting more kids back in schools. The CDC came out with guidance based upon good science that having kids closer together at 3 feet instead of 6 feet, there wasn't really much of a change in transmission of disease at 3 feet versus 6 feet. Other countries have been using 3 feet or 1 meter for quite a while without change in the disease rate in schools. We know that kids do not transmit disease as well as adults, especially kids that are in the K through 5 grades. So all of our school districts in the county are moving to get more kids back in school. We have had 134 cases of COVID-19 in all of the schools since the beginning and no in-school transmission. That's because people are masking, they're washing their hands, kids are spread apart. We know that we're going to have more kids in class, but it does not appear that we'll have more kids at risk. I'm meeting with the school unions this week. I met with school superintendents and the school nurses, and we're working on continuing a voluntary testing program, as well as continuing to test and do case and contact investigation in schools. Please, when you are outside of the school setting, continue to mask, continue to be a good example for your kids, because where do these kids get COVID that end up in school? They get it from us when we're out doing things like going to birthday parties and those kind of things. And as I said at the beginning, we are not there yet. Schools need to be open. Teachers have gotten vaccinated, school staff has gotten vaccinated, and we're ready to get kids back in school. The governor has said that all schools need to be back in full by the fall. We, in Kittitas County, my expectation is we will have all kids back in school before the end of this school year, although the 6 through 12 kids are a little bit harder than the K through 5 kids. So schools are working hard on that. The other thing I wanted to just touch base on is where we are with our current reopening phases. So we are currently in phase 3, April 12th, which is only one Monday away, 1.5 weeks away, we will be reevaluated again as to where we can be in the phases, and we can move backwards. We need to have less than 100 cases in a 2-week period of time. If you look up here, we're at 114 cases. That doesn't seem very much, but that's still above the level of where we need to be to stay in phase 3. So we need to have less than 3 hospitalizations per week period. We're right at 2 hospitalizations for COVID-19. So we are close. We're not there yet. Please continue to wear your mask. We want to continue to stay in phase 3, move into phase 4, but it's all dependent upon us wearing masks, socially distanced, washing our hands, and doing the things that we know from a public health perspective works, and getting vaccinated when you have a chance. So thanks a lot, and we'll see you next week.